Hello everyone, and welcome back to our channel. Today, we'll be diving deep into a fascinating and critical medical case that highlights how a simple vitamin deficiency can mimic and cause life-threatening conditions. This is a story of a diagnosis that requires sharp clinical thinking. Imagine this. A 48-year-old man arrives at the emergency department. He's been feeling progressively worse for about 3 weeks. He's struggling to breathe, his legs are swollen, and he's just exhausted. He tells the doctors he's been a heavy drinker for 15 years, consuming about a liter of vodka daily, and his diet has been very poor. He's also lost about 15 pounds without trying, which is always a red flag. He doesn't have chest pain, but he's been waking up at night gasping for air. When the doctors examine him, they find several alarming signs. His heart is racing at 118 beats per minute. His blood pressure is a bit low at 110/60. The veins in his neck are visibly distended, a sign of pressure building up in his heart. They hear crackles or rails at the base of his lungs, indicating fluid buildup. His heart has an extra sound, an S3 gallop, which is often a sign of heart failure. His abdomen is bloated with fluid, a condition called ascites, and his legs have severe pitting edema up to his knees. Interestingly, despite the swelling, his hands and feet are warm to the touch. The initial lab work adds more pieces to the puzzle. His lactate level is very high at 5.8, and his blood is acidic. This suggests his body's cells aren't getting enough oxygen and are resorting to anaerobic metabolism. His BNP, a marker for heart strain, is mildly elevated. His liver enzymes are also up, likely from the alcohol use. His troponin, which would indicate a heart attack, is negative. An echocardiogram, an ultrasound of his heart, reveals a serious problem. His heart muscle is weak and enlarged, a condition called dilated cardiomyopathy. The heart's main pumping chamber, the left ventricle, is only pumping out about 30 to 35% of its blood with each beat. A normal ejection fraction is above 55%. But here's the twist. The overall cardiac output, the total amount of blood the heart is pumping per minute, is actually high 9.5 liters per minute, well above the normal 4 to 8. This is what we call high-output heart failure. The medical team admits him and starts standard treatment for heart failure. IV diuretics to get rid of the excess fluid and oxygen to help with his breathing. But he doesn't get better. In fact, he gets worse. His heart rate climbs even higher, and his lactate level spikes to 7.2. The standard playbook isn't working. At this point, the team has to think outside the box. What could cause high-output heart failure with severe lactic acidosis in a patient with a history of alcoholism and poor nutrition? The puzzle pieces start to fit together. The alcoholism, the malnutrition, the high-output heart failure, the warm extremities, and the profound lactic acidosis. This clinical picture screams for one particular diagnosis. The team makes a crucial decision. They administer a high dose of intravenous thiamine, also known as vitamin B1. And what happens next is nothing short of dramatic. Within just 12 to 24 hours, the patient's condition completely turns around. His racing heart slows to a normal rhythm. His lactate level normalizes. The diuretics finally start working, and he begins to shed the excess fluid from his legs and abdomen. A follow-up echocardiogram just 1 week later is astonishing. His ejection fraction has recovered to over 50%. He's a new man. The diagnosis? Wet berry. This is a severe form of thiamine deficiency that leads to high-output heart failure. Let's break down how this happens. Thiamine is an essential cofactor for key enzymes involved in aerobic metabolism, how our cells produce energy using oxygen. Specifically, it helps convert pyruvate into acetyl-CoA to enter the Krebs cycle. Without enough thiamine, this whole process gets blocked. The cells are starved for energy and are forced to rely on anaerobic glycolysis, which produces a massive amount of lactate, leading to lactic acidosis. This metabolic failure also causes widespread vasodilation, or relaxation of the peripheral blood vessels. The heart tries to compensate for this by pumping faster and harder to maintain blood pressure, leading to that high output state. Over time, this chronic strain wears out the heart muscle. causing it to dilate and weaken, just as we saw in our patient. The body also tries to compensate by retaining salt and water, which is why we see the severe edema and ascites. The classic risk factors were all present here. Chronic alcoholism, which impairs thiamine absorption and is often coupled with poor diet, is the #1 cause in developed countries. Other risks include severe malnutrition, long-term for feeding without vitamin supplementation, or after bariatric surgery. So, what are the key takeaways from this case? First, always consider wet beriberi in a patient with unexplained high-output heart failure and lactic acidosis, especially if they have risk factors like alcoholism. Unlike typical heart failure where extremities are cold and clammy, in wet beriberi, they are often warm due to vasodilation. Second, the response to thiamine is both diagnostic and therapeutic. The rapid and dramatic improvement is a hallmark of the disease. This is why a critical management pearl is to give thiamine empirically meaning, based on clinical suspicion, without waiting for a lab test to confirm the deficiency. Lab results can take days, and the patient may not have that long. And importantly, always give thiamine before giving any glucose. Giving a sugar solution to a thiamine-deficient patient can actually worsen the condition or precipitate another neurological complication called Wernicke's encephalopathy, as glucose metabolism rapidly depletes the body's last reserves of thiamine. This case is a powerful reminder that sometimes the most complex-looking problems have a surprisingly simple solution. A basic vitamin, when missing, can bring the entire body to its knees. But with quick recognition and treatment, the prognosis is excellent, and a full recovery is possible. It is a true testament to the elegance of human physiology and the importance of sharp diagnostic skills. Thanks so much for watching. We hope you found this case as insightful as we did. If you learned something new, please give this video a thumbs up and consider subscribing for more deep dives into medical mysteries. We'll see you in the next one.